So with chiropractic becoming increasingly recognized in healthcare as one of the best approaches for neck pain, back pain, chronic muscle and joint pain, with even medical practitioners of the NHS now starting to recommend chiropractic to their patients, more and more people are seeking us out as one of the best frontline approaches for help with their pain and problems. However, you've decided maybe you want to go and see a chiropractor, you want to find out if a chiropractor can help you. The first question you're going to be faced with is, how do I find a good one? How do I find the right kind of chiropractor for me? And that's what I want to really dive deep into with this video. We're going to go through all the things that you should be looking for, things to consider when you've met them, some signs that you're in good hands and this is the right person for you, and also some warning signs and some red flags that let you know you should probably look elsewhere. Now, this is going to be quite an in-depth video. You may want to pause and take some notes. We will put a written version of this down below as well. But for now, let's dive in. Just before we do though, for those who don't know me, my name is Chris Chippendale. I'm a chiropractor and I'm the owner of Seven Oaks Chiropractic Clinic. We've been established in the area for almost 40 years now, and I've worked with many different practitioners, both at our practice, but also teaching both in the UK and internationally. So I've seen the whole breadth and depth of chiropractic, all the different ways that you can practice, and I'm really dedicated to helping practitioners deliver the best care possible and also helping my patients to get the best care possible as well. And that's what I want for you, not just whether you're in Seven Oaks, you're looking for help, but I know many of you will be watching this from other parts of the country to help you find the kind of practitioner that's right for you and that can really help you. So let's dive in. And the first thing that I really want to iterate here is that you should be looking for what's known as a patient-centered practitioner. Patient-centered care has been recommended and recognized as the gold standard of healthcare for a couple of decades now. However, not every practitioner really knows how to deliver this, and not everyone has kept up with the research and with the guidelines. Now, patient-centered care itself essentially is a healthcare that really respects your individual needs, your preferences, your values, and is really about taking a holistic view of your life. It goes beyond just finding out what the problem is, finding out what's causing your pain and fixing it, but actually creating a plan that involves you and respects you as an individual. So basically, not just recommending the same thing to you that the practitioner recommended to their last 10 patients, but really personalizing and tailoring care to do that. So what are some things you should look for in a patient-centered practitioner? Well, number one, they should be a really good listener. Because to really understand my patient's needs and operate in a patient-centered way, I've got to know about them. I can't just go in with a set of questions and assume this will tell me everything I need to know. So when you meet your chiropractor and you have that initial consultation, it should be about more than just tell me about what's the matter. It should be tell me what matters to you. Your practitioner should take an interest in finding out beyond just your back pain. They want to find out more about your life, more about the things you go through day to day. What matters to you? What do you value? What are some goals you have maybe beyond just getting out of pain? Because that's going to enable us to create a plan that doesn't just work for your back, but works for you and your life and involves you in care as much as you want to be involved as well. Now, they should also be a really clear communicator, because to really involve patients in care, create a plan that respects them as an individual, we need to be able to communicate that plan really clearly. So they should be able to easily explain what they found, what the problem is, and what their proposed solutions are to it. But not just that, it should involve you. There should be a collaboration. It's not about you being the patient and the chiropractor being the boss and telling you what to do. It should be a partnership of equals. You should be involved in the care. They should be looking for your opinions on things, looking for your preferences as well. They should be making sure that you are completely on board with the treatment plan. And then if you have any questions or you have any preferences, they should be encouraging you to ask them and share them so they can tailor that plan to you as well. And ideally, they should be taking a whole body focus. If you go in with neck pain and they only look at your neck or only look at your spine, they're probably going to be missing things. They want to be looking at things that contribute to your pain beyond just the obvious. Looking at things like, that may be posture, obviously, but that could be lifestyle. It could be stress. It could be other things that are going on in your life as well. To be a patient-centered practitioner, they need to take that whole body holistic focus. And it's really important because this doesn't only make for a nicer experience for you, it's actually going to get you a better outcome. The research is really clear that patient-centered practitioners get better results with their patients. Their patients not only get out of pain quicker, but are more likely to be able to do the sorts of things that can stop it coming back. So you get longer lasting results as well. That's what we're all about in my practice. I'm not a fan of quick fixes and things like that. It's really about helping our patients understand what they can do to help themselves as well. So That's really what you should be looking for, is a collaborative relationship where the patient wants to know about, or the chiropractor, sorry, wants to know about you and wants to involve you in the decision-making process as well. Now, that said, there are some warning signs and some things that you want to look out for as well. Because it's all well and good to know what makes a good chiropractor, but knowing what to avoid as well matters just as much there. You know, I'd love to tell you that every single chiropractor out there was an honest, decent professional and always had your best interests at heart. And the truth is, the vast majority of us are. However, like any profession, there are unfortunately some bad apples, and there are some practitioners out there who put their own interests in front of their patients. Now, like I say, it's rare, but it's really important you know how to spot that, because seeing something like that, you're not going to get the results you want, and you may end up feeling like you've wasted a lot of time, wasted a lot of money, not feeling any better, and you don't know where to turn to next. And that's not what I want for you, and that's not what I want for our profession to have that reputation either. So one of the first things to look for is the treatment plan that the practitioner is recommending to you. So with chiropractic, we often try to go beyond symptom relief. We often will go, well, it may take a few visits to get you out of pain or feeling better, but to get it to be a lasting recovery where everything is strong and moving as well as possible so it's not likely to come back, that does take more time. So chiropractors generally will recommend maybe more visits than you were expecting, because we want to make sure we get rid of the actual underlying causes as well. And if you've had pain for a while, that process can take a while as well. However, you want to watch out for over-recommending care. Some practitioners may insist on really lengthy treatment plans up front that you have to book in and pay for in advance, and they're not really allowing for any flexibility in that plan for how you do. Now, they may claim to use x-rays and things to measure your progress. We'll talk more about this in a minute, but actually x-rays are not a good way to measure progress within chiropractic, and they're not recommended by any of the guidelines for this anymore there. You want to look out for a practitioner who's pressuring you or trying to persuade you to commit to several months of care up front. Now, I have seen patients where it's taken several months to get treatment, but in all honesty, I don't feel I can accurately predict when they will need to see me beyond the first few weeks. So most chiropractors will recommend, a set number of treatments over the first few weeks, maybe a month or so, but it's not really possible to predict accurately what somebody's going to need 2-3 months down the line. You can't do that if you're a patient-centered practitioner. So if they've recommended a schedule of 3 months and are trying to book in 3 months of treatment up front, that's a sign that they might be over-recommending care, and they might be doing that because they want you to come in regardless of whether you actually need that. So you should really look out for that, and look out for somebody who's recommending all these plans and they don't really have a system built in to assess your progress on the way. What I will normally do with my patients is recommend a few treatments and then we'll reassess. And at that reassessment, I'll re-examine them, I'll find out how they've been doing, and we'll use that to then alter the treatment plan accordingly. It should be flexible because nobody can predict exactly how you'll respond in advance. The other thing to look out for that often goes along with this is they're using fear to try and motivate you. Now, part of being a healthcare practitioner is we do need to motivate people. We do want to try and encourage healthy behavior change, and that does require some motivation. However, if somebody is using fear, saying, oh, if you don't do this, it could get a lot worse, or if you don't do that, you might get this problem, that fear is never justified. A, there's not a lot of research most of the time we're doing that. But B, that's manipulation. That is a marketing tactic. That is somebody trying to push you through a sales process to try to scare you into it, not a responsible healthcare practitioner. So a good practitioner will always try to empower and encourage positively, but they shouldn't be using fear to try to scare you into doing that. Now, the other thing that can go along with this is overuse of x-rays. Chiropractic, as a profession, pioneered the use of x-rays, 50 to 100 years ago. We thought, great, we can really see the spine and that will really help us. And x-rays still have a role to play. However, with things like ultrasound and MRIs and other more modern scans now, we don't use x-rays as much as we used to. And as well as that, the guidelines have shown that they maybe weren't as useful as we used to think. So x-rays can definitely be helpful if we're worried that a patient has some damage, if they've got a problem, we have a specific thing we're worried about that we need to rule out. X-rays can be very useful, but x-raying every patient goes against all the standard procedures there. It goes against all the guidelines. Even the General Chiropractic Council, our regulator, says do not take regular x-rays, and don't use x-rays to measure progress. If your chiropractor says I'm going to x-ray you now and then x-ray you in 3 months to assess the progress, that is a chiropractor who's treating the x-ray. They are worried about the x-rays more than you and your actual health and your needs. So If they're using, everyone you know who's been to see them gets an x-ray, if they're going to take x-rays at several points along your care, that's somebody who's, like I say, more focused on what's happening on the x-ray than actually what you need. And they're likely to be doing that to justify extensive treatment plans that are maybe more than you need. So if you see a chiropractor and recommend an x-ray, they should be able to explain to you exactly what they're looking for. What are they looking to rule out? They should be using it selectively for those things. And they should still be focused on your symptoms, your concerns, and your goals, rather than just on what the x-ray happens to see. One of the things to look out for is what's known as high volume practices. Now, high volume is a style of practice where the chiropractor sees many, many patients, in less time. So they might see 8, they may see sometimes 10, even I've heard of 15, 20 patients per hour. And the way they do this is generally basically having multiple patients there. They might come in, perform a manipulation, and then put you on a machine or put you on some sort of traction or something like that. And it's a way for them to basically see more patients per hour. So that's going to improve, their earnings essentially. Often they can then use that to reduce down the treatment fees as well. So it may be a bit more economical, and that can work for routine adjustments, but it often doesn't include the privacy because you're often treated in a room with other people there as well. So if you're seeing somebody and you feel like it's a bit of a conveyor belt system, you're just another number in a queue, you get exactly the same treatment every time. Again, that's a sign that you may be seeing someone who isn't as interested in your interests as their own. And if you're unsure about that, I recommend getting a second opinion from another practitioner in the area there. So let's talk about tailoring the treatment to you. Individualized care that's tailored to you is really, really important as well, because no two people are alike. So no two treatment plans should be exactly the same either. A one-size-fits-all to chiropractic care would be very easy for me to deliver as a chiropractor if I gave everybody the same thing. I wouldn't have to think that much, but it falls short because it's not going to be tailored to you, and you're not going to get the specific care that you would need to really deal with the underlying problems as much as possible. So you really want to be looking for a chiropractor who is tailoring that care to you. For example, I've seen patients where they've had a recurring neck issue, but actually we needed to address their hand and their forearm to help with that. Or somebody who had a couple of areas in different joints, and it turns out we had to look at their diet to really calm some things down as well. So it should be a practitioner who looks at multiple things. They look at your health from multiple angles, not just your posture, not just your spine, but looking at the whole body there. And they should be able to adapt the treatment plan as you go, because being patient-centered means being, basically paying attention to the patient, how they're doing. And it means being able to be flexible in the care and adapt as we go. So they should be regularly assessing your treatment at the start of care. Every few visits, every month or two, they should be reviewing it and sitting down with you and not just telling you what the tests are showing, but also finding out how you feel things are doing, getting your input. Not just how have you been feeling lately, but how do you feel we're going? Do you feel like we should address some other areas? Is there something else that you feel could be useful to add in? I always want to know my patients' opinions because they know their body too. It's not just about me being the one who makes all the decisions. It's a combined approach from both of us there. So really that should be something that happens regularly there. They should adapt the treatment plan if your needs change. Sometimes patients, they have a big change in their lifestyle, they have a big change in work, and we need to adapt the plan for that. If the chiropractor says, nope, this is the plan, we're sticking to it, they're probably not that patient-centered. They're probably just sticking to a one-size-fits-all approach. Another thing to look out for is a chiropractor who is taking a comprehensive assessment approach. So they should be looking at the whole body. Now, as chiropractors, we're known for spinal issues. We're known as the experts in the spine, in neck pain, in back pain. So obviously we tend to focus here because most of what comes to see us are people with neck and back pain. However, I can tell you in my experience and the experience of chiropractors with far, far more years in practice than I do, often when you have an ongoing issue that's been there for a while in the spine, the arms and the legs and other parts of the body can get involved as well. And they may have been causing it or they may be contributing to it. However, most chiropractors, because all they see is spines all day, is they focus just on the spine. And they don't look at the arms and the legs. They don't look at how the knee might be affecting the pelvis, might affect the back. They don't look at how problems in the arm might be affecting things into the neck as well. So a thorough assessment is really, really key. Your practitioner doesn't have to treat the arms and legs, but they should at least have assessed them. You should feel like they've factored that into their decision-making process as well. So that's something else to look out for. Now, when it comes to the schedule, when it comes to treatment plan, there are some things to look out for as well. Typically, the way it works when you see a chiropractor is a patient will come to see me. We will sit down. We'll have a thorough discussion about what's going on, what's happening in their life, get a real picture of everything that could be playing a role. Then we'll examine the patient. And I'll have a look at all these areas and I'll perform tests and assessments to really see what's going on below the surface. And then I'll do what in chiropractic we sometimes call the report of findings. This is essentially where I share back with the patient what I found, what I think the problem is, and what I propose we do. So I'm really giving my treatment recommendations at this place. And at this point, my patient has a choice to either say, yes, I think that sounds good, let's do that. No, actually, that doesn't sound like it's for me, I'm going to try something else. Or they may go, well, I like this, I don't know if this will work. And we might discuss and change the plan based on their needs and preferences as well. And this would happen, before we start the treatment plan there. And that's pretty standard. That's making sure that my patients are involved and understand and trying to communicate as well as I can. So it's very important for a patient-centered approach. However, what some practitioners do is they will try to pressure you to commit right away. They want to know yes or no, are you going to have that? And you may feel you need a little bit of time to think it through. Those first visit or two, that whole process, it can be quite overwhelming. It's often the most thorough assessment my patients have ever had. And sometimes they want a little bit of time to think about it. It's really important that your practitioner is comfortable with you taking some time to think about it. Saying, let me think about that and get back to you, should always be a valid option. Now, most patients, don't necessarily need that, but it should be there. However, if you feel like the practitioner is starting to pressure you, if they feel like they're trying to push you into it, and they might do that through, saying, oh, do you want to, yes or no? Let's book that in and try and encourage you to book. They may do it with their pricing strategies. Something that they'll often do in some of the less than ethical practices I've seen is they'll basically say, oh, well, if you sign up today, we'll do you a big discount. We're recommending all these visits, and sometimes it is over 2 or 3 months or more. But if you book and schedule them in, you can get it. I've seen 30% off. I've even seen 50% off. Now, in reality, no business I know can cut their income by 50% and stay afloat. That's not realistic. What's happening if you're being offered a big discount off a whole treatment plan is the practitioner has artificially inflated the price to then offer you this lower discount, which is what they planned on basically charging anyway. Now, you can have practices that will offer big discounts on the first visit. They might say, I've seen patients even get 70, 80% off sometimes. That's not how we practice, but businesses and clinics that need to get more patients in, maybe they're not as busy as they'd like to be, they might offer great big discounts at the start of care. However, they're relying on a certain number of patients then coming back afterwards and paying the regular amount. So I don't mind that so much. That's not a big of a problem, but bear in mind that those big discounts are often there because they expect that some patients are going to come back. No business can offer large discounts off their service on an ongoing basis, basically. So you should be able to find clear and upfront pricing. If they're not sharing their prices with you at the start, if they're waiting until you've seen the x-rays, they've explained their plan, there may be some sales approaches going on versus actual patient-centered care there. And reasonable discounts are fine. Many practices I know will offer a discount if you pre-book a set number of treatments. You might get 5, 10, even 20% off at a push, but anything beyond that, be aware that that is a sales tactic. That is not actually about, offering the care that you necessarily need. And like I say, you should be able to say, let me think about it. And they should also be able to be flexible in their appointments. They shouldn't be trying to push you to just book what they think you should do. If you say, I hear that, but unfortunately I can't make it more than this many times, or next couple of weeks are going to be tricky with work, they may let you know that, okay, well, the treatment may take a little bit longer then, it might take a bit more time to get you out of pain, but they should be happy to meet you where you're at and be flexible there as well. So the plan should be flexible, the schedule should be flexible, and they should be willing to discuss your needs and preferences there as well. If they're trying to push you into a set plan, they may not have your best interests at heart there. So that's some other things to bear in mind there. Now, one other thing to look at that not a lot of patients are aware of, but it is really important to know, is the concept of open plan practices. Some practices will operate in a way where they actually are open plans. So you may have more than one person being treated in a room at the same time. You may go in and there's more than one treatment bench. There's some other pieces of equipment. And 2, 3, or I've even heard of places with 7 or 8 patients might be treated in that space together. Now, that's not how we practice. We have private rooms there. But it is something that is available, and some practitioners choose to practice this way. It often means that they can be a bit more efficient with their time, especially if, like the high volume places, they're putting people on other therapies while they treat somebody else. And that may mean that for routine adjustments, they can offer discounted care, and it may be more economical. Personally, I don't mind practices offering this, but they need to be really clear with it up front. The General Chiropractic Council, our regulator, the ones who give us our license and decide whether we can practice, are very clear that open plan practices have to offer a private room if you want to have a discussion privately. Because of course, if you're in a room with other people, they will overhear you. You don't get the same privacy you would in a private room there. And at the very least, that chiropractor needs to offer you a private room if you'd like to share something in confidence. You don't feel comfortable talking about your health in front of a room full of other people. That's completely fine. So they need to at least offer that, and really should offer you a private treatment room if that's something you'd prefer. Some patients quite like being in a big room with other people. There's a bit more conversation going. If you like that and you like that communal aspect to it, nothing wrong with it at all. But you should be given the option. And crucially, if you're going to be treated in an open plan environment, the chiropractor needs to tell you in advance of your visit. They cannot spring it on you on the day. That's going against the rules that we have to go by, because it's not fair to suddenly press you when you've turned up and find that out. You know, if that's something that you're not comfortable with, you should have some time to think about that and then turn it down if possible. So be aware of that. There's pros and cons to either approach there. If you have a more complex case, if you need more detailed assessment, and especially if you would just like some privacy, I would recommend going for a private treatment room and a practice that only has one patient in the room at a time. It means, we practice this way. I can give my full attention to that patient at a time. I'm not distracted thinking about other people. They've got complete privacy and dignity. So if that's important to you, make sure you choose a practice that operates that way as well. So I know we've gone through a lot here. There's a few other things I just want to briefly touch on just to make sure. Now, this first one is almost never an issue, but I do wish more patients would check it because I have heard of this happening before. You should check that your chiropractor is a qualified chiropractor. In order to become a chiropractor, we have to go through at least 4, often 5 years of university education. We have to get a master's in chiropractic, and then we have to get our license with the regulator. They will check that we have got the sufficient qualifications to be a chiropractor. They will check that we have things like indemnity insurance in place, that we don't have a criminal record that, could be a problem for us being able to treat patients fairly and offer safe care there. They will check all of that, and every year we have to reapply and show that we've continued to learn, that we've continued to grow our knowledge, that we haven't just stayed still there. And the vast majority of chiropractors do this. It's just part of being the job, and there's no problem there. However, if a patient was to make a complaint, they would go to the Chiropractic Council, and the Chiropractic Council will investigate it, and they'll decide whether there's a complaint is valid or whether something needs to be done. Now, that doesn't necessarily mean taking away their license, but that will happen if it's severe enough. It may mean the chiropractor maybe is suspended, maybe they have to be supervised for a set period of time afterwards, whatever it might be. So it makes sure that we are doing the right job and our patients are protected. They're getting care from safe, qualified practitioners who are skilled enough and safe enough to know what to do. Now, you can look this up. I'll put a link below this in the blog post. But if you go to the General Chiropractic Council's website, there is a button that says Find a Chiropractor. Before seeing your chiropractor, you should look them up. You should put their name in there and just check that they are qualified and they are registered. It will also tell you if they've had any sanctions placed on them. They've had any investigations in the past as well. I have heard of 1 or 2 people pretending to be a chiropractor who actually weren't qualified. It's very rare, but it does happen. So you need to check that as well. Another thing to look for is their additional certifications. So yes, they might be a qualified chiropractor, but have they done additional training? Maybe you have a specific issue. You might want somebody who's got more training in sports injuries, who specializes in treating pregnant patients, whatever it might be. That's a good thing to look for as well if they've got specialized training. And do they have any additional certifications? That's not required, but it shows this is somebody who has experience and is dedicated to lifelong learning. The other thing to look at, quite obviously, is reviews online. Look at places like Google, look at places where people can leave independent, unbiased reviews there. So this is something that, every business has now. It's very easy to check for. However, there's a couple of things to look for here. This doesn't happen so much now. Google's gotten really good with it, but I've seen practices in the past that bought a bunch of fake reviews where there was just 5-star reviews left with no text. It's often good to look for, did somebody write something here as well? Because then you know that it is genuine. Another thing to look for is how they handle negative reviews, because it is just part of offering a service. You cannot be the right person for everybody. Nobody has a 100% success record. And unfortunately, some people may leave disappointed. There's nothing wrong with the occasional negative review. It may mean that was a one-off unusual experience. Maybe the person didn't have the realistic expectations or didn't know what to expect there. Often it's just a failure of communication. But what you want to look for is how does the clinic respond to that review? Now, they may have chosen to have not respond to it at all. One thing I've seen, and this is generally in practices that tend to use more high-pressure sales approaches rather than patient-centered care, is because they're more concerned with their image than actually making things right and actually offering the best level of care, is they will respond to these negative reviews by saying, oh, I'm sorry, we've just checked and we don't have anybody by your name registered here. You must have the wrong clinic. Now, I've heard of that happening once or twice with a colleague and it was genuine, that they just happened to review the wrong business or the wrong practice. So if you see that once, it may be true. If you see it more than once, if you see that that's the kind of standard reply they're giving, that is probably a practice that's more concerned with their image than actually addressing concerns patients may have. So that's something to look for as well. And look for when they respond. Did they get really defensive or did they actually try to help the person? They may have, because it's publicly, most practitioners will feel like they want to sort of defend themselves a little bit as well. But is the tone, saying, let me just clarify, I'm sorry this happened, this is why it happened, but I'd like to try and make this right? Or is the tone, getting argumentative and getting defensive? It's very hard to be a patient-centered practitioner if you're really sensitive to criticism. So that's something to bear in mind as well. So I know we fired through a lot of stuff there, but hopefully that gives you a much more idea for how you can make an informed choice and help you find the best practitioner for you. Very quickly recap, prioritize patient-centered care. A chiropractor who really listens to you and understands you, but also offers a flexible plan that involves you in the decision-making process, that isn't just doing some tests and taking some x-rays and telling you what you need. You should be involved in it. They shouldn't be using fear. They shouldn't be using any kind of pressure, sales tactics, anything like that, any big discounts to try and motivate you to jump in, strike while the iron's hot. Those are things to look out for. And really do trust your gut. If you get a sense, if you leave going, oh, I'm not sure, that might help, but I don't know, it seems like there's a little bit of pressure there, stop and think about it. You should always be able to say, let me think about it and get back to you. And there's nothing wrong with going and getting a second opinion. In fact, I often recommend people, if I've got friends or family in different parts of the country and they tell me they're looking for a chiropractor, I will help them. I'll look online and see what I can find. But I'll also say it's absolutely fine to shop around. It's totally fine to see, if a patient comes to see me, I give my recommendations, they then decide to see somebody else and get their opinion and make an informed decision. I'm absolutely fine with that. It's really important that you understand what your options are. So if you're not sure about things, it's fine to shop around, get another opinion, think about it, ask around a little bit, and only return for treatment if you feel comfortable and confident that you found the right practitioner for you. So that's something to bear in mind as well. What I will say is if you're in the Seven Oaks area and you're not sure, if you're looking around, we do offer free 15-minute screening appointments. This is basically a chance for you to come in and have a chat with one of our licensed chiropractors, meet us, find out a little bit more about us. You can let us know a bit about what's going on. We can make sure that A, you are in the right place, because there are cases where somebody comes in and I go, actually, I think this person can help you better than I can. But also, you can find out a little bit more about us. We can maybe give you some recommendations and point you in the right direction. Quite a few patients have actually used that as a second opinion as well. They may say, I've gone to see this other person. This is what they've recommended. I'm not sure about it. Do you mind giving me a second opinion? And that's absolutely fine as well. We'll pop a button below this if you would like to book that. There's no obligation. You don't have to commit to anything. You can just come in, have a chat with us, and we'll see where we can help. So I hope that's been helpful for you. I hope that's given you a better idea how to make an informed choice, how to find the right chiropractor for you. And if you have any questions at all, please don't hesitate to get in touch. Our contact details will be below as well. I'd love to help in any way I can.